scientific journal is about data, and I think from the first speaker, Dr. Kefa and Dr. Susan, we all know that for you to convince any policymaker, you must have relevant data, and it must be evidence-based. And you have started it already by just having the first conference, international conference, which is also scientific. And I want to say from my experience, we launched the first conference at KNDI in 2018. And I think Mr. Riyama and team have learned from us. And so far we have had 2 international conferences in nutrition. And in 2018, we launched the Journal of Nutrition and Dietetics, which is a scientific peer-refereed journal. Currently, I'm the chief editor for that journal. I happen to have come from the academia. I was, I think, one of the youngest senators in Maseno University before I became the CEO. And by the time I was leaving Maseno University, I had published 42 papers in peer-reviewed journal. And every year, I've published 2 papers since as a CEO. And even this year, I've published 2 already. So I have about 58 papers in peer-reviewed journal. So I thought that this science cannot die. This science must be maintained within the institute. And so we made the institute a research institute because that is in our mandate. So the Journal of Nutrition and Dietetics can also be a push for you to have a Journal of Public Health, Nairobi version. The question is, most of us work hard to publish outside Africa, in the journals there in India, China, UK, US, but we don't really publish our data within our journals locally. So we have Journal of Nutrition and Dietetics, and this is a local journal, Nairobi version, and I think it is the only Journal of Nutrition and Dietetics in Africa. We know we have AJ Fund, which is on food security, but for us, we have it for the first time. Now, to establish a journal, there must be a very serious group of editors. So when you have the chief editor, you must also have editorial board. So our journal has editorial board, and that editorial board is made up of those who have PhDs. And I heard in the morning that public health officers are being encouraged to take up the matter, to get their masters and get their degrees. And I've listened to good presentations which need to be published in a journal so that that information can be kept. From the time we started the Journal of Nutrition and Dietetics, we have had 4 issues. Each year, we have peer-reviewed articles published. So we get manuscripts from our professionals. And for you to get your journal into the market outside there to be impactful, I've been asked to talk about how do you maintain it to be impactful, and how do you make it sustainable. Now, we have a journal that we don't really make money, but we give it as a platform for scientists to put their data for purposes of referencing. And we have looked at 2 things. One, the ISS number, which is print version. We also have the number for the online version, that is open access, which is coming soon. And we have also made sure that this journal is indexed. So one of the key areas for the journal to be of use and impactful is indexing. So currently, we are finalizing indexing with AJOL, that is African Journals Online, and we are also finalizing on, we have already had instituted Crossref. So if you go to Crossref, you'll find the Journal of Nutrition and Dietetics with DOIs. Now, we are getting to the level of also being indexed by Scopus. We have already submitted for that. It takes quite long for you to get into such indexing. And we are partnering also with Orchard so that we can have our journal loading for everybody who publishes there. So this journal is now at advanced stage, and it has several achievements so far. First of all, you can get into our journal online and see papers that are coming from the nutritionists or the scientists that we have within Kenya and outside Kenya. We expect the same for public health. So it is a hint for us to come up with our own journal so that we don't send them to South Africa. Now, the interesting thing about this journal is that this journal has brought collaboration for 6 universities in this country and 1 university in Nigeria, Bayero University. And so recently the journal led a training for grant writing for about 25 participants from Mount Kenya University, Maseno University, Masinde Muliro, Pwani University, Karatina, and of course, a Technical University of Kenya. And out of that, the journal is sending 10 scholars for Masters of Science in different areas across different cadres, not only nutrition. So we have MSc in maternal and child, which the journal is in collaboration with Bayero University, is now sponsoring from Kenya, from those universities, at least 1 master's for each. We have maternal and child health, we have public health nutrition, we have global health, we have mental health and policy, and then we have the other bit of it, which I think is also very relevant, is all these master's programs have policy relevance. What was the reason? That we must translate our research into policy. And it can only happen if we bring in masters and PhDs so that their research can be meaningful. So right this coming May, we are sending 10, and we are going to send 50 MSCs from those universities for the next 5 years. Now, from next year, we are sending 1 PhD from all those universities, again, on research and policy. And we have insisted that all their papers, all their researches must be brought back to the country and published within Kenya for purposes of influencing policy. And one of the areas where we want these papers published is journals, scientific journals. Now we have nutritionists and dietitians journal, that is Journal of Nutrition and Dietetics, but it can only accommodate papers in nutrition. Now, for those who will do research that are specific to global health, for example, where are they going to publish their research? Because one of our agreement is that these local researches be published within the local context, if our scholars are from here. So we want to encourage you to start one and launch. In fact, before I came, I thought there was going to be a launch of Journal of Public Health, but Professor Karama told me that it is for the next, it's in the pipeline. So I would want to encourage you, but before you start the journal, think about the editorial board, think about the impact factor, think about the H-index, and think about the indexing process. We have not reached the impact factor because it takes 5 years for you to start getting citations from your journal. But it is a good move for publishing data so that our data is not just ending in thesis, in the shelf, in the libraries of the universities, but we need to see them outside there where they are accessible. If you want to get to our journal, you will get to GND in our website and you'll see all the issues that have been published. And first of all, I want to say, those scientists that presented their paper, and they're coming from here, publish the paper. Don't present them in conference and return them back to your wardrobes or units, or in your you maintain them in the thesis. So publish them, but push the Public Health Council to come up with a scientific journal where those publications will be housed. So with that, I think it is my experience. The interesting thing to take home is that the journal is doing research, as well as publishing those researches, and journal is offering scholarship. And I think even government, Mount Kenya is here, government, I don't think they have given scholarships, but at least 5 scholarships per university for the next 5 years. Those are 50 scholarships for masters, and also 10 for PhD. I think that is great.
Wonderful.
Thank you.
Thank you.